Hemorrhoids are a very common problem, and many of our patients suffer with symptoms such as pain or bleeding, itching and discharge around the back passage, and also prolapse, where the hemorrhoids actually come out of the anal canal, and sometimes they stay out and they cannot go back in. I think it's important during this lockdown period is to maintain a healthy lifestyle. It's important to maintain a good fibre diet, plenty of fruit and vegetables, drink plenty of fluids, ensure that you do enough exercise so that you can maintain good bowel habit and then avoid constipation. In addition to this, I think a lot of the time people go in and take magazines and their telephones into the bathroom when they go to the loo, and I think it's important not to do that, to spend a long time on the loo and not to overstrain during these periods. So it may be important to take some simple over-the-counter laxatives if you find that constipation is a particular problem. One of the things really that many of my patients have to come up as an emergency is if they have pain related to hemorrhoids. And I think pain from hemorrhoids can be to two different things. If you have severe pain with the hemorrhoids that are already out of the anal canal and they've prolapsed out, this could be related to something called a thrombosed pile, which means that there is a very hard lump on the outside which is bluish, and that hard lump is related to a clot which is congealed blood in the hemorrhoids, and this can be quite tender to touch. Often this can present as an emergency, and obviously during these difficult times it's difficult to get access to go into an accident emergency to have treatment because of COVID-19. But you can take some simple measures to try and help alleviate your symptoms. Firstly, you could take some simple over-the-counter painkillers. Have regular baths. I mean, warm baths are quite good. They relax the pelvic floor, they relax the anal canal, and they soften the actual clot itself. So having baths twice a day can be very useful. In addition to this, to reduce the swelling, you can use some ice or cold compress on the actual hemorrhoid itself. I wouldn't recommend putting it directly onto the hemorrhoid. What I would do is, what I usually say is take a pack of frozen peas and you can wrap it in a soft cotton towel, and then you can mould that into around the actual lump around the anal canal, and you can sit on this area to have cold compresses at least for 20 minutes, 2 to 3 times per day. And this can help reduce some of the swelling that's related to the thrombosed hemorrhoid itself. In addition to this, your local pharmacy can have local anaesthetic gels which can be used, which are either in combination with the common hemorrhoid over-the-counter gels that you can get, like Anusol cream or Germaloid cream, but also you can get some lidocaine gels that are available that can help soothe this area. I think it's important, if you do have this, trying these initial measures, book in for a consultation with your specialist, and they can advise you and monitor this progress to make a decision whether you would need to have any emergency treatment, or indeed this can wait and be managed by these conservative measures over the next 4 to 6 weeks. And once we're over this acute COVID-19 period, then we can actually go on to book in for you to have some elective planned treatment. The other aspect related to pain is related to when there is a lot of spasm of the muscles around the back passage. And that's often due to a tear in the anal canal, which is a fissure, and this can also coexist with hemorrhoids. The difference between the pain between the two is that with a fissure, it'll be like passing glass when you open your bowels. And you'll also have some blood on the toilet paper when you wipe, and blood in the pan. But the pain that lasts often for several hours after you've actually gone to the loo to open your bowels. So the fissure itself is extremely painful, and it's quite different with the pain from the thrombosed pile. You don't often see a lump there, but you may see a small lump, which is an area of skin that is a bit bigger than normal around where the cut is. And when you have a fissure itself, I think it's important to take all the measures that I've spoken to you about earlier, except we don't really need to use ice in this situation or a cold compress. What we'd recommend is creams which are prescribed only to relax the muscles around the back passage, because often the pain is related to a spasm of the internal sphincter, which is one of the involuntary muscles around the back passage. So you can book in to see a specialist with a consultation online or telephone, and then they can send you a prescription related to a specific cream that can help you with this process.